The Global Commission on Drug Policy is a one-of-a-kind organization composed of former heads of states and high-level officials acting together on a tough and neglected policy issue.
We decided to speak with one voice on the difficult question of drug policy, in which we decided to get involved, to put our experience and our energy to end its harms.
Millions of people are marginalized, incarcerated, or injured on a daily basis by ill-guided policies on drugs.
We have led countries and governments, some of which were destabilized by violent confrontations between drug trafficking and law enforcement.
We've seen the really dreadful consequences of drug policy in terms of infectious diseases, poverty, marginalization, on people everywhere who are not allowed to speak up because the simple act of using drugs is severely punished.
And we have all come to one conclusion, regardless of our culture, nationality and background. People must be at the centre of all drug policies.
Sensible drug policy should be all about preserving dignity and saving lives, not about criminalizing millions.
We, the members of the Global Commission, have been relentlessly advocating for the end of the prohibition of drugs in favor of a better policy.
Over its first 9 years, the Global Commission built 5 key pathways for pragmatic and evidence-based reform.
1, put people's health and safety first, which include reducing harm as well as preventing and treating problematic use.
2, ensure access to controlled essential medicines, and notably painkillers and palliative care.
3, end the criminalization and incarceration of people who use drugs. That brings nothing positive and destroys lives.
4, refocus enforcement responses to drug trafficking and organized crime. Do the hard work in fighting powerful and well-infiltrated criminal organizations instead of sending millions of non-violent people behind bars.
And 5, regulate drug markets to put governments in control, which means accepting responsibility to regulate potentially dangerous substances rather than leaving them in the hands of organized crime.
These pathways are the result of a collective reflection process we started in 2011, a pragmatic and serious package to end prohibition, a model that proves on a daily basis how extremely harmful prohibition is to our youth and to our future.
In the last 9 years, we saw the consensus that led to the punitive drug policies fall into pieces.
Prohibition was wrong from the very start. Battles fought in the name of prohibition were lost, not without causing millions of human lives in the process.
The so-called war on drugs has achieved nothing but death, despair, and poverty.
When in office, some of us led repressive policies. It didn't work. We could argue we had less evidence, less proof of the harms of prohibition. We prefer to focus our energy on preventing that errors of the past be repeated in the future.
Drug policy today, after 50 years of failed prohibition, is a colorful canvas of different approaches.
Some countries arrest thousands of people who use drugs, with or without trial, and send them to jail or even to the gallows.
Others, by contrast, have adopted creative, science-based and pragmatic policies that start concentrating on governments finally taking responsibility.
We now need to envisage the world after the war on drugs. Humane drug control can support poverty eradication, better health, better socioeconomic development, more human rights for all.
Our principles and recommendations include a solid and pragmatic path for a transition to better drug policy. Look forward to seeing over 10 years the results of carefully guided regulation.
As the late Kofi Annan said in private, activism on novel issues usually comes from young people. This time, it is us, the elderly, that are changing drug policy. Today and tomorrow, we commit to continue on this path on advocacy for reform with all our partners and all those advocating for people-centered policies.